Mood disorders are characterized by extended periods of depressed or irritable mood, in addition to sometimes euphoric states, but which cause significant distress and interfere with daily life. Everyone experiences brief periods of sadness, irritability, or euphoria. This is different than having a mood disorder, such as major depression or bipolar disorder. A major depressive episode, or MDE, refers to symptoms that co-occur for at least 2 weeks and cause significant distress or impairment in functioning, such as interfering with school, work, or relationships. This often includes anhedonia, or a loss of interest or pleasure in things that one typically enjoys. Patients must be experiencing at least 5 symptoms among the following: poor mood, diminished interest or pleasure in activities, significant weight loss or gain, or increase or decrease in appetite, insomnia or hypersomnia, in other words, sleeping too much or too little, psychomotor agitation, such as fidgeting or restlessness, fatigue or loss of energy, feeling worthless or excessive and inappropriate guilt, diminished ability to concentrate or indecisiveness, or recurring thoughts of death, suicidal ideation, or suicide attempt. A major manic episode, in contrast to a major depressive episode, typically involves feeling abnormally and persistently euphoric, expansive, or irritable in terms of mood, and persistently increased goal-directed activity or energy. Hypomania is a milder version of mania that typically lasts for a shorter period. So mania in this case is the more severe form. To be diagnosed as an episode, the mood disturbance must be present for 1 week or longer in mania or 4 days or longer in hypomania. And the episode must have at least 3 of the following: inflated self-esteem or grandiosity, increased goal-directed activity or psychomotor agitation, again, that's restlessness or irritability, sleeplessness, racing thoughts or flight of ideas, distractibility or difficulty concentrating, increased talkativeness, or excessive involvement in risky behaviors. Depressive disorders, which are also called unipolar mood disorders, include both major depressive disorder, or MDD, and persistent depressive disorder, or PDD, also known as dysthymia. Major depression disorder is defined by one or more major depressive episodes, but no history of manic or hypomanic episodes. Criteria for PDD, or persistent depressive disorder, are feeling depressed most of the day for more days than not for at least 2 years. At least 2 of the symptoms listed here are also required to meet criteria for PDD. This includes poor appetite or overeating, sleeping difficulty, fatigue or low energy, low self-esteem or guilt, difficulty concentrating, and feelings of helplessness. The symptoms of persistent depressive disorder need to cause significant distress or impairment and cannot be due to the effects of substance or a general medical condition. To meet criteria for PDD, a person cannot be without symptoms for more than 2 months at a time. PDD also has overlapping symptoms with MDD, so these two do often co-occur. If someone meets criteria for a major depressive episode during persistent depressive disorder episode, then the person will receive both diagnoses of PDD and MDD. Bipolar disorders stand in contrast to unipolar mood disorders because they include symptoms of mania in addition to depression. In fact, in earlier versions of the DSM, bipolar disorder used to be called manic depression. Now they're referred to as bipolar 1, bipolar 2, and cyclothymic disorder. These are the 3 major types of bipolar disorders described by the DSM-5. Bipolar 1 is characterized by the presence of a single or recurrent manic episode, and no depressive episode is required for this diagnosis, even though it is commonly present. Bipolar 2 is characterized by single or recurrent hypomanic episodes and depressive episodes. And cyclothymic disorder is characterized by numerous and alternating periods of hypomania and depression lasting at least 2 years. To qualify for cyclothymic disorder, the periods of depression cannot meet the full diagnostic criteria for a major depressive episode. The person must experience symptoms at least half of the time, with no more than 2 consecutive symptom-free months, and they must cause significant distress or impairment, but generally cyclothymic disorder is less severe, with only small ups and downs. The wavy image on your slide depicts the minor peaks and valleys that are not strong enough to cross the line that would qualify for a diagnosis of bipolar disorder.